Good evening, everybody. Thank you so much for joining me. And tonight we'll be going over the mental health technician practice test. I see a lot of people in the comment section already, so thank you guys for attending tonight. All right, let me switch this over. Okay, so today's practice test is designed especially for CNAs and patient care technicians who play a vital role in caring for patients experiencing mental health challenges. As a frontline caregiver, you are essential in providing compassionate daily care, recognizing signs of emotional distress, supporting patient safety during mental health crises, and working closely alongside with nurses and doctors and mental health team. Alex, congratulations. I'm so happy to see that. This practice test will help strengthen your skills, boost your confidence, and prepare you to deliver safe, respectful, and effective care in a mental health setting, whether in hospitals, long term care facilities, or specialized behavioral units. Let's get started and empower you to be the difference for your patients. Congratulations, everybody. And Gigi, I recommend that you go to floridacareeracademy.com and look on there. They have so many different practice tests, and just make sure that it's not one already on there. If you don't see one on there already, I would like for you to email admin, so ADMIN, at fltraining.com and requesting a phlebotomy practice test. Marvelous says, my test is tomorrow. I'm so nervous. You can do this. You got this. All right. So there's a critical need for trained mental health technicians nationwide. As the demand for mental health services grows, skilled CNAs, PCTs are uniquely positioned to transition into mental health care roles. If you're serious about making a difference in the mental health care, visit www.fltraining.com. Or you guys could call us at 877-225-7151 for more information. And start your journey to becoming a certified mental health technician today. All right. Someone asked how my day was. My day isn't bad. I have a little cold, just a little head cold. It's allergy season right now where I'm at, and I have bad allergies. So if I sound a little different, that's why. But thank you guys for hanging on with me. All right. So let's get ready for your practice test. Let's build your confidence. And before we begin, we want you guys to have a quiet space to focus, have a notebook or scratch paper ready, read each question carefully and think like a mental health technician, and trust your instincts. You already have the heart for patient care because that's why you guys are here learning with me. All right, here we go. So we have 45 questions tonight. This is question number one. So, what is the primary role of a mental health technician? A. Administer medications independently. B. Perform psychiatric diagnoses. C. Provide support and monitor behavior under supervision. Or D. Offer psychotherapy sessions to patients. 70, I see your comment here about the live for the phlebotomist. If they choose to do one in the upcoming future, you will see it as an upcoming live stream on YouTube by following this page. All right, I'll give you guys about 5 more seconds in 5, 4, 3, 2, and 1. Great job in the comment section. The correct answer is C. Mental health techs assist patients with daily care, monitor behavior, and report changes. They do not diagnose or treat independently. So always remember, you guys, your scope of practice. You don't want to do anything outside of your scope of practice because that could get you into trouble. So you want to just make sure that you're doing what you are supposed to be doing. Question number 2. Which law allows for the involuntary examination of a person due to suspected mental illness in Florida? A. HIPAA. B. EMTALA. C. The Baker Act. Or D. Tarasoff Law. This is a tough one, so be sure if you don't know the answer, still select the answer, because selecting a answer is better than skipping it because it gives you more of a chance to get the correct answer. I'll give you guys about 3 more seconds here in 3, 2, and 1. The correct answer is C, the Baker Act. It's a Florida law that permits involuntary examination for individuals showing signs of mental illness who may harm themselves or others. So, if there's something that you haven't learned before, I recommend that you guys jot it down so that you know this in the near future. And it's okay to get it wrong, but you always want to learn from it. So, if you get the question again in the future, you will get it correct. All right, question number 3. Which of the following symptoms is commonly associated with depression? A, hopelessness, B, increased energy, C, euphoria, or D, hyperactivity? And another thing that I do, you guys, is like words. Like if you guys have never seen euphoria before, be sure to write it down so you can look it up because you want to expand your vocabulary because in the healthcare field, you'll be hearing these things on a daily basis. So you want to familiarize yourself with them. All right, in 3, 2, and 1. The correct answer is A. Excellent job there, you guys. Feelings of hopelessness, sadness, and withdrawal are typical in patients experiencing depression. Question number 4. What is the most appropriate immediate action for a CNA when a psychiatric patient verbalizes suicidal ideation? A. Tell them to stay positive. B. Notify the nurse immediately. C. Leave the room quietly. Or D. Lock the patient in their room. I will reveal the answer in 3 seconds. In 3, 2, and 1. The correct answer is B. Excellent job again. Suicidal ideation is a medical emergency. The nurse must be notified so that the proper mental health protocol can be followed. Question number 5. Why are patients' personal belongings often searched during admission to a psychiatric facility? A, to identify fashion preferences. B, to inspect insurance coverage. C, to ensure safety and remove harmful items. Or D, to collect taxes. All right, I will reveal this answer in 5 seconds. So 5, 4, 3, 2, and 1. Excellent job there, you guys. Personal belongings are searched to remove potentially dangerous items like sharp objects or medications. So that correct answer was C. Question number 6. A Baker Act typically lasts up to A, 8 hours, B, 24 hours, C, 1 week, or D, 72 hours. Okay, let's reveal this answer in 3 seconds. So 3, 2, and 1. The correct answer is D. So in Florida, the Baker Act allows for 72-hour hold, involuntary hold for psychiatric evaluation. Please note that each state handles involuntary mental health holds differently, and while the idea behind them is similar, the laws, names, and procedures may vary. Please research your state's guidelines on involuntary mental health holds. All right, question number 7. Which behavior would most likely require a body search in a locked unit? A, asking to go home. B, refusing to eat. C, aggressive outbursts in suspicion of contraband. Or D, crying quietly. Give you guys about 5 seconds with this one. In 5, 4, 3, 2, and 1. The correct answer is C. Excellent job there. I believe all you guys got that correct, so thank you for that. Aggressive behavior combined with suspected possession of banned items may lead to a body search for safety reasons. Question number 8. Patients placed on a 1-to-1, if you guys ever see that written like that, that means 1-to-1 observation, are typically A, free to go outside alone, B, closely monitored due to high-risk behaviors, C, allowed to keep all personal items, or D, responsible for medication administration. So be sure you guys are thinking about what the question's asking, reading your question slowly along with the answer choices. Okay, we'll reveal the answer in 3 seconds. In 3, 2, and 1. The correct answer is B. Patients placed on 1-to-1 observation are typically under constant supervision because they are considered at high risk for self-harm, suicide, or harming others. The goal is to ensure their safety and provide immediate intervention if needed. Question number 9. Which of the following items would typically be prohibited due to safety concerns in a psychiatric facility? A, a hairbrush, B, rubber shoes, C, a metal nail file, or D, a toothbrush? Give you guys a few more seconds here. 3 seconds in 3, 2, and 1. The correct answer is C. Excellent job there. Items that can be used as weapons, like metal nail files, are considered contraband. Question 10. What is the primary intervention for preventing elopement in a psychiatric facility? A, increasing patient autonomy. B, installing security alarms and monitor systems. C, allow the patients to leave the unit during the day. Or D, encourage the patients to sign in and out of the facility. All right, in 3 seconds, in 3, 2, and 1. Good evening, Vivian. Sorry. And I see a lot of people returning. I see Miss Benita, Tori, Loretta, Mila. Thank you guys, and many others who have returned to join in with us. All right, the correct answer is B. To prevent elopement, when a patient leaves the facility without permission, facilities often use security measures such as alarms, locked doors, continuous monitoring to ensure patient safety and prevent unauthorized departures. Question number 11. You are assisting on a Baker Act unit when a patient states, I don't see the point anymore. I just want everything to end. What is your first course of action? A, encourage the patient to talk about their feelings. B, offer the patient a comforting distraction like music or a book. C, stay with the patient and ensure they are not left alone. Or D, try to convince the patient to get out of bed and participate in activities. Okay, I'll reveal the answer in 3 seconds. In 3, 2, and 1. The correct answer is C. It's important to ensure their safety by staying with them and not leaving them alone. This helps reduce the risk of self-harm or other dangerous actions while professional help is being sought. And you guys, another thing, there's a big stigma with mental health. So always be sure that you are empathetic to the patient, because the patient could be having a midlife crisis. They could have had a family member die and it caused them to go into a mental health crisis. You know, there's so many things that people go through and you don't know what they're going through. So be sure that you're always kind to everyone and that you treat them like you want to be treated. Question number 12. A patient under a suicide watch is brushing their teeth and suddenly becomes agitated. You notice they are holding the toothbrush aggressively. What should you do? A. Calmly redirect and notify the nurse. B. Leave the room. C. Grab the toothbrush immediately. Or D. Call a code over the intercom. Okay, we'll reveal the answer in 3 seconds. In 3, 2, and 1. The correct answer is A. De-escalation and safety are priorities. Stay calm, redirect the patient, and call for assistance. So always make sure that you're keeping yourself safe as well as the patient. Question 13. You are conducting a belongings inventory. Which item should be removed from a new patient's bag? A. A family photo. B. A journal. C. A hair tie. Or D. Alcohol-based mouthwash. Okay, let's go ahead and reveal this answer. The correct answer was D. Mouthwash is alcohol. Mouthwash with alcohol is dangerous in the mental health setting and must be removed as a safety precaution. Alcohol could be used for misuse or ingestion. For patient safety, such items are typically removed from the patient's belongings during an inventory. So I've seen a few different mixed answers there. So always, whenever you're going through your questions, think about what the best answer is. And in this case, what would pose the most imminent threat. All right. Which of the following best describes a legal takedown technique during a mental health crisis? A. Grabbing the patient's arm forcefully and twisting it behind their back. B. Using a trained two-person escort to lower the patient safely to the ground. C. Sitting directly on the patient's chest to prevent movement. Or D. Applying pressure to the patient's neck to restrict breathing. If you do some of these, you're going to jail. So definitely don't do those. But again, use your process of elimination. Give you guys about 3 more seconds for this one. In 3, 2, and 1. The correct answer is B. Using a trained two-person escort to lower the patient safely to the ground. A legal technique must prioritize patient safety and minimize harm. A trained two-person escort allows controlled movement and prevents injuries to both the staff and the patient. Twisting arms, sitting on the chest, and applying pressure to the neck are dangerous and illegal restraint practices. Mila asks, what is the legal takedown technique? It all may be a little different depending on facility, but what your main safety thing is that the patient's able to breathe and that you're not using excessive force. So sometimes if they have to take them down to the ground because one, they may be trying to harm staff, but you always have 2 people involved in that, and that's to maintain safety for the patient so that they don't harm themselves or others, and also to maintain safety on the unit as well. Question 15. A patient with depression has not eaten in 2 days. What is the CNA's role in this situation? A. Offer a variety of food choices and check if the patient shows interest in any of them. B. Document the patient's refusal to eat and leave the patient. C. Provide emotional support and attempt to talk to the patient. Or D. Encourage the patient to eat small, nutritious meals throughout the day. Salma, that's in every state for the legal takedown. I'll give you guys about 5 seconds to answer this one. In 5, 4, 3, 2, and 1. The correct answer is D. Encourage the patient to eat, especially if they are struggling with depression or not eating. Positive reinforcement and support can make a difference in their willingness to eat. So question 16, an elderly patient begins withdrawing from activities, expresses feelings of worthlessness, has difficulty sleeping, and reports changes in appetite. Which disorder is most likely? A, Alzheimer's disease, B, major depressive disorder, C, generalized anxiety disorder, or D, schizoaffective disorder. Yep, Milo, you are correct mentioning that the patient in a nursing home may have depression because they don't want to be there. So, you want to take that all into account because a patient most of the time they're either with their family or they have their own home or something of that sort. So, taking them from their home into another place where they don't know anyone and they're learning all new things and they don't have their own um, home to themselves, it could be a lot. But then sometimes they're also, I've seen patients say, I wanted to come to the nursing home because I've lived so long, outlived all my family, and I'm getting friends here. We're doing activities, we're doing fun things. So that could go both ways. All right, we'll reveal this answer now. The correct answer is B, major depressive disorder. Depression is common, but often underdiagnosed in older adults. Withdrawal, appetite changes, insomnia, and feelings of hopelessness are hallmark symptoms of major depressive disorder. Alzheimer's would involve memory loss and confusion rather than feelings of worthlessness alone. Question 17. Which action is appropriate when searching a new admission's personal belongings? Hold on one second, guys. I gotta sneeze. Okay. A, perform the search alone without gloves. B, allow the patient to keep medications from home. C, search with another staff member present and document items. Or D, let the patient decide what to turn in. Give you guys 3 seconds to answer this one. And 3, 2, and 1. Correct answer is C. Belonging searches must be conducted by 2 staff with proper documentation for safety and accountability. So in the picture above, it shows the inventory list. So that may be electronic or it may be paper charting where you're writing down what the patient came in with because when they leave, they should be leaving with what they came with. Question 18. You're on a locked unit and a fire alarm sounds. What should you do? A, evacuate the patients without informing the nurse. B, wait to see if it's a false alarm. C, unlock all doors immediately. Or D, follow the facility's emergency protocol. You guys about 3 seconds to answer this one. And 3, 2, and 1. Correct answer is D. Good job. Mental health units have specific emergency procedures that must be followed for safety and security. Question 19. A middle-aged patient frequently washes their hands for long periods and checks locks repeatedly, despite knowing their behavior is excessive. This is most consistent with A, post-traumatic stress disorder, B, panic disorder, C, obsessive compulsive disorder, or D, schizoaffective disorder. Give you guys about 5 seconds to answer this one. And 5, 4, 3, 2, and 1. The correct answer is C, obsessive compulsive disorder. OCD involves recurrent intrusive thoughts, which are obsessions, and repetitive behaviors, which are compulsions, aimed at reducing anxiety. Patients are usually aware their behaviors are excessive but feel driven to perform them. Question 20. You are assisting with laundry. A patient becomes upset when you touch their clothes. What is the best response? A, I'm just doing my job, stop overreacting. B, I'll give you space. Let me know when you're ready. C, I'll wash them with someone else's clothes then to save time. D, the clothes are dirty and must be washed now. All right. We'll reveal the answer in 3, 2, and 1. B, we want to respect personal boundaries. Mental health patients may have trauma histories, and allowing choice promotes dignity and trust. So coming back later, that would be a great option because they may be more relaxed later to go ahead and do that. Question 21. Can you guys hear me fine? If you guys can't, please let me know. Because my ears are a little clogged, so my hearing is not the best, but I just want to make sure you guys can hear me fine. A patient in a mental health unit begins crying and states, "Nobody cares about me." What is the most therapeutic response? Okay, thank you guys. A, that's not true. You have to stop crying. B, you'll feel better soon. C, you're being dramatic. Or D, let's talk about why you feel that way. Give you guys about 5 seconds. So for me, mental health, I really like my mental health. Of course, whenever I was in nursing school, but it was very difficult for me to learn that. So if you guys are having trouble, just learning the diagnosis and like the symptoms and stuff that go with it, I recommend you guys continue to do practice tests because it is different. It's different than medical, but it's something that we all need to learn because we want to take care of our patients holistically, which means mind, body, and soul. So we want to do all those things. So definitely study up on it so that you guys, whenever you see a patient with these diagnoses, you know what to do. All right, we'll reveal the answer now. The correct answer is D. Open-ended, non-judgmental responses promote trust and allow patients to express their feelings. So great job there. Question 22. While assisting a patient with daily care, a mental health technician notices that the patient reaches out and inappropriately touches them. What is the best immediate action for the MHT to take? A. Ignore the behavior to avoid escalating the situation. B. Finish the bath but tell the patient to stop touching you. C. Yell at the patient to stop and threaten consequences. Or D. Firmly but respectfully set a clear boundary and remove themselves from the situation. I know you guys know this one because you guys are very intelligent. There you go. Great job there. We'll reveal that answer in 3, 2, and 1. So we want to firmly but respectfully set clear boundaries and remove yourself from the situation. Professional boundaries must be immediately reinforced to protect the staff and the patient. Calmly but firmly stating that the behavior is inappropriate and safely stepping away is the correct response. Ignoring, yelling, or abandoning the patient are unsafe and unprofessional reactions. So you may have this happen, but definitely set your boundaries and then remove yourself from the situation. All right, I'm sorry. Question 23. A patient begins yelling loudly during group therapy. What is your role as a CNA? A. Shout over them to regain control. B. Restrain the patient immediately. C. Calmly remove the patient and notify the team. Or D. Leave the room. Give you guys about 3 seconds to answer this one. In 3, 2, and 1. Let's reveal the answer. The correct answer is C. Stay calm, prioritize safety, and remove the patient from overstimulating environments as needed. Question 24. A patient on a locked unit asks if they can go outside to get fresh air. What should you do? A. Unlock the door and let them go. B. Explain that going outside is not permitted without permission. C. Accompany them outside immediately. Or D. Allow them to go as long as they agree to return. You guys about 5 seconds to answer this one. In 5, 4, 3, 2, and correct answer is B. Patients on locked units must be approved to leave. So the key word there was that it's a locked unit. The nurse or the physician must authorize such requests. Question 25. You find a sharpened pencil hidden in the patient's pillowcase. What should you do? A. Leave it since it's just a pencil. B. Dispose of it quietly. C. Put it on the table so that the patient can write in his journal. Or D. Report and secure the item per facility policy. Give you guys about 3 more seconds to answer this one. In 3, 2, and 1. The correct answer is D. Even everyday items can be dangerous in a mental health unit. Follow protocol to secure and report. Question 25. Which of the following could be a sign of escalating aggression? A. Relaxed posture. B. Whispering softly. C. Clenched jaw and pacing. Or D. Laughing and smiling. You guys 3 seconds to answer this one. In 3, 2, and 1. Correct answer is C. Physical signs like clenched fists, pacing, or jaw tightening may indicate growing aggression or agitation. Question 27. A mental health tech is assisting a patient diagnosed with schizophrenia who is experiencing auditory hallucinations. What is the best approach to help the patient manage the situation? A. Tell the patient the voices are not real and ignore them. B. Acknowledge the patient's experience without confirming the hallucination and redirect their focus. C. Engage in detailed conversation about the voices to better understand them. Or D. Argue with the patient to convince them the voices do not exist. Give you guys 5 seconds for this one. In 5, 4, 3, 2, and 1. The correct answer is B. Acknowledge the patient's experience without confirming the hallucination and redirect their focus. The MHT should acknowledge the patient's feelings without validating the hallucination. Redirection towards reality-based activities help decrease anxiety without escalating symptoms. Let's see. Stella, you passed your CNA exam. Congratulations. I'm very proud of you. I know that you'll do great in the field. Question 28. A patient with a history of trauma becomes highly agitated during a routine vital sign check. Which technique should the MHT use first? A. Quickly complete the procedure before the patient escalates further. B. Demand the patient calm down so that the care can continue. C. Use trauma-informed care principles by explaining each step and asking permission before proceeding. Or D. Restrain the patient immediately to prevent injury. Give you guys 3 seconds to answer that one. In 3, 2, and 1. The correct answer is C. Use trauma-informed care principles by explaining each step and asking permission before proceeding. Trauma-informed care emphasizes choice, safety, and empowerment. Explaining procedures and seeking consent helps reduce the risk of re-traumatization and helps build trust. Question 29. Which of the following would be most concerning behavior for MHT to report immediately? A. A patient gives away personal belongings and expresses hopelessness. B. A patient asks to speak to a social worker about discharge planning. C. A patient quietly refuses lunch and asks to stay in their room. Or D. A patient talks openly about feeling homesick and missing family. Give you guys 5 seconds to answer this one. Naileen, congratulations. I'm very proud of you as well. You guys, it's great that you guys are passing. I know that you guys are very smart and you guys will do very good. So congratulations and keep up the good work. All right, let's go ahead and reveal that answer. The correct answer is A. Patient gives away personal belongings and expressing hopelessness. Giving away possessions and expressing hopelessness are red flags for suicidal ideation. Immediate reporting to clinical staff is essential to ensure patient safety. Question number 30. Why are shoelaces removed from a patient's shoes in mental health units? A. To reduce tripping. B. To prevent fashion distractions. C. To prevent fights. Or D. They can be used for self-harm. Naileen, to find the skills video, you can go to www.fltraining.com. And then to also look for more classes, you can go to www.floridacareeracademy.com. There's lots of resources on there. And even on this YouTube channel, if you go to previous visits, there are a lot of videos on here, a ton of information on the site. All right, you guys, the correct answer is D. Shoelaces are common ligature risk and are removed to prevent injury or self-harm. Great job answering that. Question 31. A patient is on elopement precautions. What does that mean? A, they are getting married. B, they may try to leave the facility without permission. C, they refuse medication. Or D, they're violent. No problem, Lily. All right, let's see what this answer is in 3, 2, and 1. The correct answer is B. Elopement refers to a patient trying to leave a facility unsafely or without authorization. So you guys know your medical terms. If not, you would have maybe thought they were going away to get married, because that's also elopement. So you want to make sure that you know your terminology, which I know you guys do. So good job answering that. Question 32. A CNA is charting on a patient with schizophrenia. Which observation is the most appropriate to document? A, patient is crazy. B, patient is talking to themselves, stating that they hear voices. C, patient is being annoying. Or D, patient is manipulative. Give you guys 5 seconds to answer this one. In 5, 4, 3, 2, and 1. Correct answer is B, excellent job. Objective observations are crucial. So we want to describe what is seen or heard without judgment or labeling. So you guys know, excuse me, whenever you're charting, we chart facts only. Opinions are not things that we put in the chart. We are charting only facts. So some of those other things were opinions. So we need our objective data. And remember, either it was last week or the week before, we talked about the difference between subjective data is what the patient says, and remember it starts with S, so subjective, or objective data is what you can use with observations. So O, observations, and objective. S, subjective and what they say. All right, question 33. Which approach is most effective when caring for a patient with paranoia? A, confront the patient. B, use sarcasm to ease tension. C, provide consistent routines and avoid surprises. Or D, argue to correct their thinking. You guys 3 seconds to answer this. And 3, 2, and 1. Correct answer is C. Routine and consistency help patients with paranoia feel safe and reduce mistrust. So you guys see where they're talking about arguing or yelling. We don't want to do that to the patient. Our job is to keep the patient safe, so we want to de-escalate, not escalate the situation. So, if you see that as an answer choice, automatically mark that one out. That's unless it says what would you not do. So be careful reading those questions, but we know that's not therapeutic, so we're not going to even pick that as an answer. Question 34. Why might a mental health patient be placed on 15-minute checks? A, to improve medication compliance. B, to ensure that meals are eaten. C, to remind them to shower. Or D, to monitor safety due to self-harm risk. Give you guys about 5 seconds to answer that. All right, here we go. Correct answer is D. Frequent checks help monitor patients at risk for self-injury or emotional crisis because we want to make sure that they're okay. Question 35. During a physical altercation between two patients, a mental health technician steps in to separate them and sustains a minor injury. What is the first action the mental health tech should take after ensuring patient safety? A, finish the shift and report the injury at the end of the day. B, ignore the injury if it seems minor and continue working. C, seek revenge by confronting the patient involved. Or D, immediately report the injury to a supervisor and complete an incident report. Give you guys 5 seconds to answer this one. In 5, 4, 3, 2, and 1. Great job there, you guys. The correct answer is D, immediately report the injury to a supervisor and complete an incident report. Injury management in healthcare facilities must follow proper procedures. Reporting the injury immediately protects the employee legally, ensures medical evaluation, documents the event for workplace safety records, and prevent further issues. Ignoring, delaying, or retaliation is unprofessional and unsafe. How could the mental health technician get injured, might ask? So say that you are on the unit observing patients. They're in the day area. Maybe they're talking about something and the patient gets upset and they may hit a mental health tech. I did a psych rotation before and a lady, she got very upset. She was calm and she picked up a chair and was getting ready to throw it at him. So they had to de-escalate. But yeah, you could in any area of the healthcare field, we always want to make sure that we are being safe and we're protecting our patients as well as protecting ourselves. But if you guys do get injured on the job, you want to report that immediately. Even if you feel like it's minor, it could turn into something much bigger. Like I got hurt one time. I was helping pick up a patient. He was sitting down and I was just helping him rise to the standing position. And I'm about 5'5" for my height. He's about maybe 6'3". And when he got up from the chair, he stood up, but then he yanked back down and kind of tugged at my back. So I had to do therapy for that. But after I made sure he was safe, I went and I made a injury report for myself because I want to make sure that I'm safe and not causing any injury because I'm being unsafe. So definitely report those things. Let's see. Yolanda says, hi, everyone. It's my first time here. Well, thank you for joining. On Monday nights at 6:30 Central Standard Time, I go live with you all. And then Nurse Eunice also goes live at a different time during the week. You guys, this week, Nurse Eunice will be live tomorrow at 7:30 p.m. Eastern Standard Time. So tune in and be there or be square. That's what they say, right? Miley, it's okay. It's all right. The patient he was very sorry about it. He didn't mean to. It's just a risk that I just came across, but it was okay. He even gave me a hug after, and I was like, it's all right. No, you didn't mean to. He just got kind of weak with it. But yes, always be sure to use your proper body mechanics, which I did. It just happened to be a different situation at the time. But yes. I got a cough. Hold on one moment. All right, we are on to question 36. When is it appropriate for a mental health technician to assist in applying emergency restraints to a patient? A, when the patient is refusing to follow staff instructions. B, when the patient is verbally abusive to staff. C, when the patient becomes an immediate danger to themselves or others and least restrictive interventions have failed. Or D, when the patient refuses to attend group therapy sessions. Give you guys about 5 seconds for that. And 5, 4, 3, 2, and 1. The answer is C, when the patient becomes an immediate danger to themselves or others and less restrictive interventions have failed. So emergency restraints are only used when last resort, when a patient poses an immediate risk or other de-escalation methods have failed. So, a patient will have a care plan or plan of care. It would tell you when they exhibit this, we want to do this as the first step. So, like I've seen where different patients, it's like you want to give them space. Then after that, you can do different things. And then, if they continue to escalate after so many interventions, that's whenever we would have to use a more restrictive restraint. But restraints, we do not put a patient in restraints unless we absolutely have to. So we always want to make sure we are doing the least restrictive restraint first and then work our way up. Like you shouldn't be given a chemical restraint right off the bat. And by chemical, I mean like an intramuscular injection. If I was a nurse doing that, I would first want to do like a verbal de-escalation with them first to see if that would help. Question 37. After assisting with the application of emergency restraints, hold on one second, guys. What is the mental health technician's primary responsibility? A, leave the patient alone to calm them down in the restraints. B, check on the patient every hour. C, allow untrained staff to remove the restraints when they feel appropriate. Or D, monitor and document the patient's physical and emotional status at regular intervals. So the question, it even has it in capitalization. What is the primary responsibility? I'll give you guys 3 seconds to answer this. In 3, 2, and 1. The correct answer is D. Monitor and document the patient's physical and emotional status at regular intervals. So once restraints are applied, continuous monitoring of the patient's airway, breathing, circulation, mental status, and comfort is mandatory. Documentation of observations at set intervals, often every 15 minutes depending on policy, protects the patient's safety and staff legally. Leaving the patient unattended, allowing unauthorized staff to intervene, or waiting for distress signals are unsafe and violate legal standards. So one of the options was an hour. If you left a patient unattended for an hour after they have been in restraint, a lot can happen in an hour. So, we want to be doing those frequent checks to make sure that they're safe. Question 38. What is the best way to de-escalate a patient who is yelling but not yet physically aggressive? A, threaten to restrain them if they do not speak softly. B, match their energy. C, speak calmly and allow space. Or D, threaten to call security. So when we talk about de-escalation, what that means is basically calming the patient. So we're not doing anything to make the situation worse. We want to reverse that and bring them to a calming state. I'll give you guys 5 seconds for this. In 5, 4, 3, 2, and the correct answer is C. Calm communication and physical space can de-escalate tense situations. Question 39. In an inpatient mental health facility, how should a mental health tech handle situations where patients who are alert and oriented times 3, expresses a desire for sexual activity with one another. Allow the patient as long as both patients seem willing. Remind the patient that sexual activity is not permitted in the facility and redirect them appropriately. Encourage the private time between consenting adults to promote autonomy. Or D, ignore the situation unless one patient is confused. Give you guys 3 seconds for that. In 3, 2, and 1. The correct answer is B. In mental health facilities, sexual activity between patients is prohibited unless or regardless of perceived consent. Patients may have impaired judgment, be vulnerable to exploitation, or lack full decision-making capacity. Mental health technicians must set firm, respectful boundaries, remind patients of facility rules, and redirect behavior appropriately to maintain safety, dignity, and legal compliance. So if you guys learned something new with that one, be sure to jot it down so you know for next time. All right, question number 40. Which patient behavior should a CNA report immediately on a locked unit? A, giving away belongings and saying goodbye. B, refusing group therapy. C, singing loudly. Or D, skipping a snack. Give you guys 3 more seconds to answer that. In 3, 2, and 1. The correct answer is A. Good job there. This may indicate suicidal ideation. Giving away items is a common warning sign. Question number 42. What should you do if a confused patient keeps trying to open locked doors? A, block the door. B, yell at them. C, redirect calmly and offer reassurance. Or D, allow them to try again later. Give you guys about 5 seconds to answer this one. Okay, we will reveal the answer. The correct answer is C. Patients should be redirected without confrontation, and the nurse should be notified of escape attempts. What is a locked? Let me go back. It's a locked unit. So if a patient is on a psych unit or a mental health unit, those are usually locked units because the patient, if they are there voluntarily, they will have a staff member let them out. But if not, if they are there involuntarily, you don't want to have it unlocked to where they're leaving, especially, if it's court ordered with the Baker Act and things like that. So that's what that is. It's a mental health or a psychiatric unit, and that's locked compared to your medical surgical units at the hospital. When you go onto those, you can just walk right in, see your family. The patients can get up and walk in the halls and things like that, as long as it goes with their activity orders. But on a locked unit, they cannot leave the unit without permission, including going outside, like was mentioned earlier. All right. Right. Question 42. Why is accurate and timely documentation, no problem, critical for mental health technicians working in mental health facilities? A, it ensures that staff can gossip about patient behavior more easily. B, it allows the technician to express personal opinions about the patient. C, it helps the facility avoid doing unnecessary paperwork. Or D, it serves as a legal record of care provided. It helps coordinate the patient's treatment plan. We got about 5 seconds to answer that one. All right, we will reveal the answer now. The correct answer is D. It serves as a legal record of care provided and helps coordinate the patient's treatment plan. Documentation is a legal record of what happened during care and is crucial for patient safety. Communication among team members, continuity of care, protection against legal liability. It should always be professional, objective, and completed promptly. So you guys know that the chart is a legal document. So anything that you chart in there can be used. So you may have done something maybe 20 years ago and a patient had an encounter or something, or they go sue someone, or things may happen. It ends up in court. You always need to be sure that you're documenting appropriately to where you would be able to remember what you did on that day, at that time if you were called to the stand. So always be able to back up your documentation, and always tell people, paint a picture with your words so you know what you did inside of your head. But if I'm an outsider coming in and I'm looking at this patient's chart and it just says went outside, and I'm like, well, what are they talking about? If you say, like, I escorted the patient outside, we went on a walk for 15 minutes and returned safely to the unit, I have a picture painted in my head, and I'm like, okay, I see that. I understand what the patient and the staff was doing. So be sure to always document appropriately that you could be able to recall it in the future. Question 43. A patient in the day room is repeatedly rocking back and forth and unresponsive to your voice. What should you do while waiting for the nurse? A. Shout their name. B. Shake them awake. C. Leave them alone. Or D. Stay close to the patient. All right, we will reveal the answer in 3 seconds. So 3, 2, and 1. Correct answer is D. Great job there. This could be a sign of withdrawal or dissociation. Alert clinical staff for further evaluation. All right, question 44. You overhear 2 patients planning to take down staff tonight. What is your responsibility? A. Tell your coworker later. B. Keep it a secret. C. Immediately report the threat to the charge nurse. Or D. Pretend like you didn't hear it. All right, let's reveal the answer. Correct answer C. Great job there. Staff safety depends on immediate reporting of threats or violence. So, you want to report that threat immediately so it can be further looked into, because when we clock in for work, we want to leave the same way we came in. We do not want to be harmed during work, so we want to be reporting those things. Question 45. What is the best way to approach a patient with PTSD during morning care? A. Wake them up loudly. B. Touch them without warning. C. Gently announce yourself and ask for permission. Or D. Pull back their covers to start care. Give you guys 3 more seconds to answer this. And 3, 2, and 1. The correct answer is C. Trauma-informed care includes respecting personal space and offering choices. So if somebody has post-traumatic stress disorder, you just don't want to come up and touch them without their permission. It's important that you are respecting boundaries and giving them personal space, as well as offering choices with them. All right, you guys. So that is all of our questions for tonight. And always remember that caring CNAs become caring nurses. And thank you guys for watching. If you haven't done so already, be sure to like, share, and subscribe, and follow us at Florida Training and also at Eunice Mathis. And thank you guys. I hope that you guys have an amazing week. I hope I feel better too. Thank you guys. I'm sipping on my tea, while we were going through this. I'll take me some medicine whenever we get out of here. But thank you guys so much and have a great week. If anybody is doing their testing this week, good luck with that and congratulations. I know you guys will do well. Let's see, somebody said, can I do question 6, I think? Let me see. Could you please do question 6? Yes, we can go back to that. Give me 1 second. Are we needing the answer for question 6, Marvelous? There's question 6 again. So it's asking, what is the primary role of the MHT? Administer medications independently, perform psychiatric diagnosis, provide support and monitor behavior. Under supervision, or that's not question 6, hold on. That's slide 6. Give me 1 second. That would be... There we go. Question 6, it says a Baker Act typically lasts up to 8 hours, 24 hours, 1 week, or 72 hours. Marvelous, let me know when you have it. And Donzo, I'm praying for you. I hope that you do your best. Always stick with your gut. Read your questions slowly and always pick the best answer. Marvelous, are you ready? Okay, I said 24, 72. Yes, the correct answer is 72. And then there's the rationale there. So it's 3-day involuntary hold. And if you guys are wondering about how it differentiates from state to state, be sure to research your state guidelines. All right, you all, thank you again and have a great week. And I will see you all next week. And be sure to tune in tomorrow at 7:30 p.m. Eastern Standard Time with Nurse Eunice. Bye.